Okay, so it's exactly on the hour. Welcome. My name is Cindy. I represent Nasco Healthcare. We're so excited to partner with MVR Technologies today to bring you a demonstration and a webinar on the latest solution, which is virtual reality medical training in nursing. Today, the speakers will be Elena. She is the International Marketing Manager. Also, Paul. He is the International Sales Manager. Just to let you know, today we are recording this webinar for future viewing. You guys will be able to communicate and ask your questions through chat. So with that, I'm going to, hand it off to Elena. Go ahead.
Thank you, Cindy. Welcome, everyone. We are happy to see you here today on our new simulator MVR-Nursing launch. And we are very excited to tell you more details about our product because we put a lot of effort and heart in developing this VR technology, new technologies in simulation industry. So MVR company developing virtual reality solution that offers students and healthcare professionals true to life training simulation built on cutting-edge technologies. MVR Nursing is fully immersive learning process which helps learn faster and improve practical skills without any risk to real patients in real life using realistic environment. I want to let you know that both of our product, MVR Nursing and XR Clinic, does not require any consumables or spare parts, which means unlimited, value for money, cost-effective use for your customers or clients. Our target is mainly educational organizations, which is medical university, medical colleges, medical schools, and even hospitals, where people can test and examine potential employees in different departments. The key features of our MVR nursing product is mostly the lowest price in the industry, lifetime license, and outstanding graphic that leads the industry. We developed the unique teleportation feature, which allows you to use our product in small rooms. Faster setup time, load and respond. No additional space needed for product use. As I mentioned, you can use our products, both of our products, being in a small classroom with 20 students, just using a chair and our set of goggles. We develop intensive care team management and different nursing departments, such as emergency, medical care, and pediatric. PricewaterhouseCoopers research indicates that VR technologies in our life now is a cost-effective and user-friendly way to learn and practice technical and soft skills in any specialty or any industry. Their statistics show us that VR learners learn and training 4 times faster than in the classroom and 4 times more focused on than their e-learner in a classroom. 3 times more emotionally connected and involved in the learning process and after they apply their skills in real life. And for 275% more confident to apply their knowledge and skills which they learned in the classroom practicing with VR technologies. MVR nursing allows training of nurses' professional skills through deep immersion in clinical practice with zero risk to real patients. With our product, you have hardware and software. So when you purchase our product, you have goggles, controllers, carry case, which is hardware, as well as software, lifetime license, and 2 supportive web services, which is Case Manager, Scenario Editing Tool, and Smart Center, administrative web interface. In our product, you will find outstanding graphic and deep immersion inside the simulation sessions, complex evaluation system for debriefing and analytics, realistic environment, and lifelike patient interaction. And now I would like to ask Cindy, please read any questions. If anybody have any, we are ready to answer on the first part of our presentation. And after, I will ask my colleague Paul to demonstrate our new products. Cindy, do we have any questions?
We do not have any questions at this time.
Great. Paul, then over to you, please. Let's stream a demonstration.
Thank you very much, Elena. Hello, everyone. My name is Paul, and I will guide you through the deep immersion journey of the MVR-Nursing Simulator. Right now, we're starting the stream, so you'll be able to see exactly the same as we can see from the VR goggles. Please excuse us for a little bit latency due to the Zoom settings, and the quality of picture will be also a little bit simplified due to the streaming. Here we are. Let me introduce you to MVR-Nursing, which is the virtual hospital where nurses with different qualifications can train their skills in the immersive environment. Let's experience the first case, which is cardiac arrest scenario, the ACLS protocol for APRN nurses training. Will appear in the emergency ward. Our patient will be lying on the bed and breathing hard. Let's teleport closer to the patient and take a look at the medical history. Teleportation is extremely useful saving space feature for the simulation center area. Our patient is in a poor condition. We can see it in his eyes, in his facial expressions. Let's ask him, how does he feel?
I feel really bad. I have chest pain. Oh, doctor, it's hurting.
He has chest pain. His breath is getting slower. Eyes are closing. Patient has went unconscious. Checking the pulse with our hand, we can feel the vibrational feedback in controller exactly the same rate as the pulse is. And the pulse is exactly really low. Let's set up sensors to check vitals on the monitor. We're setting the BP meter on the arm, ECG electrodes on the chest, and connecting each sensor carefully to the equipment. Every detail matters and should be performed in a correct order, such as in a real practice here. As soon as we have connected sensors, we will be able to observe vitals on the patient's monitor, heart rate, blood pressure, SpO2, and others. Setting up the oxygen, we should accurately choose the stream of it, because if the stream is too low, it may not work at all. We have also a large library of medications in the simulator. Students may choose various ways of introduction, drug concentration, and dosage. There is also a calculator there, which is available to count the dosage manually. We'll prepare the parenteral atropine, pick the syringe, and administer the drug through the catheter. We can also displace the syringe after the introduction. Unfortunately, the condition of the patient is not getting better. We have to call the ICU team to help us to save the patient's life. And we're pushing the code blue button. And here the team is coming. This is the ICU team, which will help us to save the patient. As an APRN nurse, we will give orders to each of them to perform airways, CPR, and shock. Each manager is in charge of a concrete function. So choosing them with the controller, we can choose options for the commands. As we can see, patient's condition has been changed. 0 pulse is an asystole, so we have to act immediately. We have to prepare shock and choose the energy. The energy should be also correct. If it's too low or too high, it may harm the patient.
Stay clear. Shock delivered.
When the shock is ready, everyone should step back. Special shock timer will allow us to control each shock to be delivered timely. If you do it too often or too rare, it may also harm the patient. Each scenario is provided with automatic evaluation. Every action is scored and the timing is also there. 3 types of grades: positive, negative, and neutral. The report will be saved in the Smart Center interface and will be available for the teacher and the student. Okay, and now let's jump to another ward to show the pediatric scenario briefly. We will pick the pediatric asthma case, and you can see the ward is totally different. Wall colors are fancy. There's a nurse and the mother of the patient to collect the medical history from her.
Hello. My daughter is experiencing difficulty in breathing.
Communication here is available only with the mother of the child. That position should be changed to inspect the patient properly. And tools are a bit different here comparing to ICU because it's a regular ward. We have no monitors here, just regular BP, temperature, and pulse sensors. Medication library is the same and allow us to choose various drugs, for example, oral tablets. Administering tablets, there will be also a glass of water to give to the patient. We have various equipment here available. For example, a peak flow meter helps us to check the breath of the patient. The auscultation of lungs and bowel is also available. And the palpation is also there. As it is the asthma case, we have a nebulization feature. And to work properly with nebulizer, we have to choose the medication, connect the mask properly to the equipment, and start the nebulization. Yeah, pushing the button here. One more tool is glucometry. We can check the sugar level with it. We'll install a needle into the tool. Take the paper strip, go and puncture the patient's finger to take the blood with the paper strip and install it to the glucometer. This is how we can check sugar level of the patient. IV machine allows us to work with different medications. For example, we can select the fluid in the medications menu, connect the catheter with the IV. All actions are done manually. And select the flow, start the IV. As this case is a regular ward and a regular nurse is there, so we have to use the physician to report to him and follow his orders.
Please start salbutamol nebulization of 2.5 milligrams in 5 milliliters of normal saline followed by oxygen administration at 2 liters a minute.
Doctor's order will be saved on the wall, so it makes us way easier to operate with that and do not forget anything. And the same as the previous scenario, this one is provided with a complete evaluation report, which is saving the information in the Smart Center interface and will be available for the teacher and the student constantly. That is all for the demonstration by now. Thank you very much for your attention. And we are ready to go to the questions, I think.
There was 2 questions. One was, is this license for a lifetime? And also whether or not it is possible to edit or create your own scenarios. If you can cover both those, that'll be good.
Sure. Thank you for that. Yes, we have exactly the same commercial model as we use with the XR clinic. So the license for MVR-Nursing VR is lifetime, and you will receive all the updates which will be coming through the year. And one more feature is the case manager, as Yelena has already announced, is going in the package. So you are able to edit scenarios and information in that. I will surely show up it to you by the end of the presentation. So I can pass word to Elena to continue with slides.
No more questions, yeah? No, okay. So as you saw at the moment, right now, we have different words and different type of scenarios. Let me tell you a bit more about our words and what it includes. So our scenarios allows you to experience the most realistic practice in a different nursing departments. The first one is emergency ward. Hone vital life-saving skills. Train with realistic medical equipment. Assess patient conditions and foster teamwork according to ACLS standard for first-rate patient care. So in this environment, you can practice different skills and you can use medical devices, medical equipment, practice your dialogue skills, as well as teamwork and clinical thinking. A second one, as you saw as well, it's a pediatric ward, child, where you can practice as well different skills, communication with the child, communication with the parents, as well as doctors. Here, comprehensive overview of common childhood illnesses and treatment options with a hands-on experience for enhancing proficiency in delivering child-focused care. And third one, the standard medical ward, handling diverse medical conditions, utilizing hospital equipment and devices for managing chronic illnesses and patient complications. In MVR nursing, we have over 10 unique patient profiles with a range of genders, ages, and body types. Interactive patient communication via dialogue. Comprehensive examination including visual, instrumental, and physical examination as a palpation and auscultation. Critical resuscitation procedures such as CPR, artificial ventilation, defibrillation, and more. Fundamental patient care techniques, oxygen therapy, which we just saw in pediatric case, nebulizer treatment, ECG, etc. Advanced medication administration, such as infusion pumps, IV drips, syringe, and many, many more. And now we would like to tell you about our supporting web services. So Case Manager, we already received a few questions about scenarios. Case Manager is a user-friendly, multifunctional web service designed for customizing scenarios. This service allows you to change patient data, student objective, primary complaints, the patient vital signs for each scenario phase. Dialogue exchanged between patient, doctors, nurses, and other characters as a parent we saw in a child scenario. Laboratory test parameters and medication dosage. So as you see, it's very functional service which can help you to make your educational process so unique for students and yourself that no one else, no other company can offer you in MVR simulators. And second web service is a Smart Center. It's easy to use web interface for comprehensive reporting and administrations. Detailed statistics, real-time session monitoring, and license management. In this web service, we have two main lines, which is real-time session monitoring, which allows teachers access to each simulator or student session and monitoring what they're doing, how they pass in scenario, etc. And second one, it's complete set of statistic data. Summary data of each user, reports, videos, assessment, and outcome analysis for debriefing. In this case, you can collect all data for group students or one student for whole period of use in simulator or just for exact date or period, analyze that, analyze video, and debrief that with students. And now I will ask Paul to demonstrate to you our Case Manager web service. Paul, over to you, please.
Thank you, Lena. I will briefly show you the interface of the Case Manager. Many of you are possibly acquainted with our XR Clinic Case Manager, which looks mostly the same. So on the starting page, we can see the cases list, and we can choose any case and edit mostly any kind of information here. For example, we are able to retype the students' objectives here, retype anything here, make any kind of corrections, adjustments up to the study process needs. We can choose location, the type of a case, text on the medical pad, patient's information, like a name, gender, age, anything. More, we can control patient states, which are patient conditions that may be constantly changing during the case. So here we have the HR, CO2, BP, SpO2, palpation results. So any results of any interaction with the patient inside the simulator and his vital signs. All of them can be customized. You can add new patient states as well. Thank you very much.
Okay, yeah, thank you everyone to attend today for our new product launch. We hope you liked it. If you have any other questions or you will have after presentation, please contact your sales directors and they will be able to take you through your questions. And if you will have even more, or maybe you will request a separate demo, especially for you, maybe in more details, we are ready to do that as well. And again, please contact your sales director with that request. And we thank you for your attending today and have a nice day.